Here are USMLE-style questions focused on defective proximal tubule PCT bicarbonate reabsorption, characteristic of type 2 renal tubular acidosis, proximal RTA, resulting in non-anion gap metabolic acidosis. Each question includes 4 answer options and an explanation. Question 1. Type 2 RTA Pathophysiology. A 6-year-old child presents with muscle weakness, polyuria, and failure to thrive. Labs reveal HCO₃, 16 mL/pool, K-test 2.9 mL/bleed, urine pH initially and 5.5 but later 5.5, anion gap is normal. Which of the following is the most likely mechanism? A. Inability of α-intercalated cells to secrete hydrogen ions. B. Impaired HCO₃'s reabsorption in the proximal tubule. C. Aldosterone deficiency. D. Increased NAKK exchange in the collecting duct. Answer B. Impaired HCO₃ reabsorption in the proximal tubule. Explanation. In type 2 RTA, the proximal tubule cannot reabsorb filtered bicarbonate, leading to bicarbonaturia and metabolic acidosis. Urine pH is variable, initially high but later acidic as HCO₃ is depleted. Question diagnostic pattern. A patient with Fanconi syndrome has polyuria, hypokalemia, glucosuria, and non-anion gap metabolic acidosis. What is the primary cause of the acidosis? A. Aldosterone resistance. B. Loss of bicarbonate in urine. C. Impaired NH excretion. D. Increased ketogenesis. Answer. Loss of bicarbonate in urine. Explanation. Fanconi syndrome involves generalized PCT dysfunction leading to HCO₃ MACE wasting, type 2 RTA, among other solute losses. Question 3. Treatment response. A child with type 2 RTA is given oral sodium bicarbonate. Despite therapy, acidosis persists. Why? A. Urine pH remains alkaline due to distal RTA. B. Proximal tubules continue to waste bicarbonate. C. Aldosterone blocks distal acid excretion. D. ADH resistance prevents water reabsorption. Answer B. Proximal tubules continue to waste bicarbonate. Explanation. In type 2 RTA, the proximal tubule has a limited capacity to reabsorb HCO₃- even with supplementation, making correction difficult. Question 4. Associated syndromes. Which of the following inherited disorders is commonly associated with proximal renal tubular acidosis, type 2 RTA? A. Alport syndrome. B. Bartter syndrome. C. Fanconi syndrome. D. Little syndrome. Answer C. Fanconi syndrome. Explanation. Fanconi syndrome causes generalized dysfunction of the PCT, including loss of glucose, amino acids, phosphate, and bicarbonate. Question 5. RTA type comparison. Which feature differentiates type 2 RTA from type 1 RTA? A. Hyperkalemia. B. High urine pH persistently. C. Low urine pH after bicarbonate is depleted. D. Increased anion gap acidosis. Answer C. Low urine pH after bicarbonate is depleted. Explanation. In type 2 RTA, once plasma HCO₃ is reduced, the distal nephron can acidify urine, pH 5.5, unlike in type 1 RTA. Let me know if you'd like.